Alpha-1 antagonists are a drug class that includes prazosin, terazosin, doxazosin, and tamsulosin. These OSIN drugs are responsible for the relaxation of smooth muscle and are used clinically to treat benign prostatic hyperplasia and hypertension. In this visual mnemonic video, I'll cover everything you need to know about alpha-1 antagonists, so you're ready for test day. Let's get started. Ah, what a beautiful view! Today we find ourselves along a winding road overlooking the ocean. By the way, this ocean is our anchor and symbol for OSIN drugs. Get it? Ocean for OSIN? You see, alpha-1 antagonists all have drug names that end with OSIN. These drug names include prazosin, terazosin, doxazosin, and tamsulosin. Now that we've anchored ourselves to the drug name, let's explore the rest of our scene to learn more about these drugs. Oh no! It looks like somebody crashed their motorcycle! Maybe he was on his way to an oceanside picnic because he had a bottle of A1 sauce in his bag. If you've seen our videos on the adrenergic receptors, you might recall that A1 sauce is Pixorize's recurring symbol for the alpha-1 adrenergic receptor. Because A1 stands for alpha-1, right? And this A1 sauce bottle was definitely broken in this crash. We'll get back to this crash and why it happened later, but this broken A1 sauce should remind you of alpha-1 receptor antagonism. The OSIN drugs work by blocking or antagonizing alpha-1 adrenergic receptors. So what happens when you block these alpha-1 receptors? Well, let's find out. Next, take a look at this red drawstring bag that the A1 sauce came falling out of. You can see why the sauce fell out, since the bag came loose and opened in the crash. This open or widened opening of our drawstring bag is our symbol for vasodilation, or relaxation of smooth muscle, the major effect caused by blocking alpha-1 receptors. You see, alpha-1 signaling normally causes vasoconstriction and smooth muscle contraction. By blocking alpha-1 signaling, we get the opposite: smooth muscle relaxation and vasodilation. This relaxation of smooth muscles around the tubes of our body has further downstream clinical effects, as we'll discuss next. I think I may have figured out why our friend here crashed. Look at his tire. There are multiple holes in the tire, releasing all the air pressure, and that probably caused him to crash. The release of this high pressure from the tire kind of reminds me of one of our clinical uses of alpha-1 antagonists, to treat hypertension or high blood pressure. How does this work, you ask? Well, drugs like prazosin and terazosin antagonize alpha-1 receptors, which cause relaxation of smooth muscle, especially around the blood vessels. The resulting vasodilation reduces vascular resistance, reducing blood pressure. To understand this, think of the garden hose as an analogy. Relaxing your grip around the garden hose causes the tube to dilate, reducing the resistance to flow, and causing the water, or blood, inside to spurt out with less force or pressure. This is the mechanism by which all of the OSIN drugs can be used to treat hypertension, with the exception of tamsulosin. Why tamsulosin? Well, tamsulosin, while being an alpha-1 antagonist, is selective for receptors on the prostate. We'll get to what effects alpha-1 antagonism has on the prostate in a bit. Just picture this flat tire losing all its pressure to recall that OSIN drugs can be used to treat hypertension. If it seemed like things couldn't get much worse for our friend here, on top of losing his precious sauce, he's all wet as well. It looks like he fell into a water drain. You know, like the little runoffs on the side of all mountain roads. He must be a little dazed because he's just sitting there, blocking the drainage and allowing all the water to build up above him. By the way, the blocking of this water drain is our symbol for the other clinical use of alpha-1 antagonists, to treat benign prostatic hyperplasia, or BPH. You see, relaxation of smooth muscle in the prostate can relieve the urinary obstruction caused by prostate overgrowth. This can help treat the symptoms of BPH. BPH is the major use case for which you will see these drugs in real life on test day, so you would do well to remember it. Hypertension and BPH are two main conditions the OSIN drugs are used to treat. But for all you gunners out there, you might also want to know that alpha-1 antagonists may be used to treat PTSD. The rationale here is that PTSD may be caused, in part, by excess adrenergic arousal. By blocking alpha-1 receptors, the OSIN drugs can block some of this adrenergic arousal and thereby relieve the symptoms of PTSD. Clinically, this is a pretty rare use case of PTSD and is not all that classic or important, as other psychiatric drugs like SSRIs and the like are preferred to treat PTSD. As such, I wouldn't focus here and would instead devote more attention to the other symbols in this picture. Okay, now to the side effects of these drugs. Remember when I said our friend here might be in a daze from his crash? He certainly looks dizzy with all those stars around his head. His dizziness is our symbol for the most common adverse effect of taking the OSIN drugs, orthostatic hypotension. Orthostatic hypotension is basically lightheadedness or dizziness upon sudden changes in body position, and it can even present as syncope or loss of consciousness, especially right after the patient's first dose. The mechanism here is pretty easy to understand. Alpha-1 receptors are typically responsible for changing blood pressure to ensure enough blood gets to the brain in response to body movements, so we don't pass out every time we get up from bed. By blocking alpha-1 receptors, this compensatory mechanism is blocked, so people can get dizzy from sudden changes in body position. Just picture this dizzy guy after his crash to recall that orthostatic hypotension is a common adverse effect when taking OSIN drugs. Alright, that's it for the alpha-1 antagonists. Let's summarize what we've learned. The alpha-1 antagonists are a class of drugs that end in the common suffix OSIN, including prazosin, terazosin, doxazosin, and tamsulosin. As the class name would suggest, alpha-1 antagonists work by inhibiting or antagonizing alpha-1 adrenergic receptors, which cause relaxation of smooth muscles, especially around blood vessels and our urinary tracts. Clinically, relaxation and dilation of blood vessels can be used to treat hypertension, while relaxation and dilation of urinary tracts can be used to treat benign prostatic hyperplasia, or BPH. Finally, a high-yield adverse effect of these drugs is orthostatic hypotension, which presents as lightheadedness, dizziness, or loss of consciousness in response to sudden changes in body position. Okay, now we're actually done. I better go make sure this guy's okay after his crash. At least we have that beautiful ocean view while I apply first aid. I'll see you in the next one.